So basically, if you're asking what is prostate cancer, you should know what is the prostate first. So when you say prostate cancer, it's a cancer of the prostate. What is the role of the prostate? Where the prostate is a part of the male reproductive gland, and it produces most of the semen at the time of ejaculation in a male. Fortunately, it's only the prostate. The prostate gland is only seen among male. There is no prostate gland in female. So, expect prostate cancer only in the male. It is located at the neck of the bladder and where urine passes, and controls also part of the urine during urination. So when you say prostate cancer, it is cancer of the prostate.
So what are the signs and symptoms of prostate cancer?
Basically, there are sometimes diagnosed prostate cancer as no signs and symptoms at all until you reach the later stages of prostate cancer. So that's why it's very important to have a routine checkup for your prostate gland. The Philippine Urological Association is really campaigning a routine check for the prostate. That's why during Father's Day, it is the work of the PUA to do a routine digital rectal exam all over the Philippines. That's why we do that during the Father's Day or before the Father's Day will come, just to make an awareness of what is the role of the prostate. So it's very important to do a DRE or a digital rectal exam and a PSA for all males above 45. So that's the role of the Philippine Urological Association, to keep people aware that we have a prostate gland that we have to take care of. So signs and symptoms, basically, sometimes in the later stage, you're going to have frequency of urination, dysuria, hematuria, but that's already sometimes a later part. Because when you diagnose prostate cancer, there is also a staging. In staging, we have the low risk, we have the high risk. Then it all depends on your PSA, on your biopsy result. So that makes a difference also in the treatment. Well, in the American male, it's very important in the American male, as the journals would say, that 85% of American male are diagnosed to have prostate cancer. It's probably because of the improvement in the diagnostic procedures. They have their good equipment, and as far as the diagnosis is concerned.
How is prostate cancer treated?
There are so many treatments as far as treatment is concerned. In the early, let's say, as I mentioned, we have the very low risk, we have the low risk, then we have the intermediate risk, then we have the high risk. Sometimes in the low risk, we just do active surveillance. What do we mean by active surveillance? We just observe the patient, we just watch the patient. We don't even give medicines for that. But you have to do a regular checkup. A regular checkup will include a digital rectal exam, a routine PSA, and it all depends on if it's necessary to do a biopsy, then you have to do a biopsy. Then it all depends on what is the stage of your cancer. If it is only T1, T2A, sometimes we just do active surveillance. You just watch the patient. especially if the PSA is only below 10. So you just observe the patient. So it all depends. And treatment will all depends on different patient. But there is no definitive treatment that you're going to do this on one patient and you're going to do the same on another. Sometimes it varies. There's not definitive treatment in every individual.
Doctor's advice.
That's why in the countries that are very very keen of eating red meat, the tendency of prostate cancer is very high compared to countries that are very fond of eating fish and vegetables. Red meat sometimes is connotes something like there is a connection between the eating of too much red meat and prostate cancer. But there is already a comparison compared, like Japan is very fond of vegetables and fish. That's why probably their risk of prostate cancer is very low. So, but you know, it's not definitive that when you eat a lot of, you're going to have prostate cancer. And number one is history. Family history is very, very important. In patient with the family history of prostate cancer, you have to do a lot of, especially within the whole family, in all males, that you have to do all these tests just to eliminate that they have prostate cancer. It runs really there is a genetic probability.